Hi friends, welcome to the channel The Nurse. Here we are discussing about Railway Staff Nurse Exam Questions and Answers 2025 with their explanations. We will move to the topic. Before that, if you are not subscribed to our channel, please subscribe. We will move to the topic. Railway Nursing Exam Questions and Answers 2025. We will move to the first question. Which of the following is a negative symptom of schizophrenia? Auditory hallucination, delusions of grandeur, flat affect, pressured speech. So correct answer here, flat affect. That is negative symptom of schizophrenia. Negative symptom means it involves a loss of normal function. So there will be a lack of a function that normally seen in a person. So for example means flat affect, social withdrawal. These are the examples. So flat affect means the affect will be flat. There is no emotional changes there. Social withdrawal means that withdrawal from society. He will not involve actively with the other colleagues or neighbors. Then hallucination and delusions that are usually seen in schizophrenia. That is example of positive symptoms. That is excess or distortion of normal function. In schizophrenia, both symptoms will be there. Negative symptoms will be there. Positive symptom will be there. And pressured speech that is usually seen in mania, not seen in schizophrenia. What is pressured speech? That is a rapid, excessive difficulty to interrupt speech that feels urgent or driven. The person talks non-stop and may be difficult to understand because they hardly pause for others to speak. So that is pressured speech seen in mania. Which of the following is a key principle of delegation in nursing? Assign task based on seniority only. Delegate only to licensed practical nurses. Ensure the delegatee has the competency to perform the task. Never delegate medication administration. So this question coming from nursing management. Here correct answer is ensure the delegatee has the competency to perform the task. So if the nurse doesn't have a competency, he cannot perform the task. So first the delegatee has competency in that particular task. Safe delegation requires matching the task to staff members' skill. So based on the staff skills, the delegation should be happened. Seniority alone does not guarantee competency. LPNs can perform certain tasks, but delegation depends upon scope of practice. Some medication administration can be delegated if legally permitted. So that is some examples of delegation. Next question. Which leadership theory focuses on rewarding good performance and correcting poor performance? Transformational leadership, transactional leadership, servant leadership, laissez-faire leadership. So here correct answer is transactional leadership. Transactional leadership, there will be reward for good performance. If there is any mistake happens, there will be a corrections or punishment will be there. So that is what transformational leadership. Then that is inspires through vision. Servant leadership prioritize employees' needs. Then what is laissez-faire? Laissez-faire leadership, it is hands-off, not performance-driven. That means the leaders doesn't have power over employees. The employees will take the decision and they will work for achievement of goal. That is laissez-faire. In fourth question, in a research study, external validity refers to the accuracy of measurements, the generalizability of findings to other settings, the consistency of results over time, the absence of bias in sampling. The correct answer is generalizability of findings to other settings. That means the research study that can be applicable out generally. That is a simple form of definition of external validity. There is an internal validity. Internal validity means we can apply that only in that particular study. So external validity means it can result applied to other population or settings. In a research study refers to the extent to which the study's findings can be generalized or applied to other settings or populations or times or situations outside the study sample. In simple terms, external validity means it answers the questions, that is, can the result be applied beyond these particular studies? Then internal validity. Internal validity means accuracy within the study. It cannot apply outside the study. Then reliability. Reliability simply means consistency of results. Sampling bias means it affects validity but is not its definition. So sampling bias means there will be error in selection of sample. Which Fifth question, which PowerPoint feature allows you to rehearse and time your presentation before delivering it? So this question is from Microsoft Office. So options are slide sorter, presenter view, rehearse timings, animation pane. So correct answer is rehearse timings. Rehearse timing is one of the options seen in PowerPoint. Rehearse timings helps practice and set slide durations. So we can set a slide duration for each slide. Then we can save it. Then automatically it will play in that particular time. Slide sorter means it used to organizes slides. It sorts slides. Presenter view means displays notes during presentation. So here I am doing video with presenter view only. Animation pane means another option that controls slide effects. So we can give different effects during the slide transition. Sixth question, a patient with borderline personality disorder or BPD is most likely to exhibit grandiose sense of self-importance, fear of abandonment and unstable relationships, preoccupation with orderliness, lack of empathy. Correct answer is borderline personality disorder person may have fear of abandonment and unstable relationship. Borderline personality disorder is characterized by emotional instability, fear of abandonment, and impulsivity. These are the common features of borderline personality disorder. Grandiosity is seen in narcissistic personality disorder. In another condition, grandiosity is seen, delusion of grandiosity, that is seen in BPD or mania. Then orderliness, that is usually seen in obsessive compulsive personality disorder. Then last option, lack of empathy, is usually seen in antisocial personality disorder. Seventh question, which financial terms refers to the point where total revenue equals total cost? Net profit, break-even point, marginal cost, return on investment. Correct answer, break-even point. Break-even points, that is equal to no profit or loss. Revenue, that is equal to cost. Net profit means revenue that minuses from expenses. Marginal cost, that is cost of producing one more unit. ROI, that is profitability measure. Eighth question, which research design is best for studying rare diseases? Cohort study, randomized controlled trial or RCT, case control study, cross-sectional study. Here correct answer is option C, case control study. Case control studies compare affected versus unaffected individuals, efficient for rare diseases or rare conditions. Cohort study follows group over time, better for common disease. It cannot be applied for rare diseases. RCT is experimental but impractical for rare disease. At the same time, cross-sectional studies assesses prevalence at one point of time. Then, which of the following is a first-line treatment for generalized anxiety disorder or GAD? GAD. Haloperidol, lorazepam, sertraline, lithium. Correct answer is sertraline. Sertraline is used for first-line treatment of generalized anxiety disorder or GAD. As you know, haloperidol is an antipsychotic, first generation antipsychotic. Lorazepam is an example of benzodiazepine, but some condition in some generalized anxiety disorder, lorazepam or benzodiazepine can be used for a shorter period, but for a longer period, always sertraline can be used. Lithium. So, what is the use of lithium? So, lithium is usually used in the treatment of choice in BPAD or mania. Selective serotonin reuptake inhibitors or SSRIs like sertraline are first-line treatment for GAD, generalized anxiety disorder, due to their efficacy and safety profile. Haloperidol is an antipsychotic not used for anxiety. Lorazepam is a benzodiazepine used short term due to dependency risk. Lithium is a bipolar disorder, a drug of choice for bipolar disorder, not used in GAD. 10th question, which leadership style is most effective in a crisis situation in a hospital? Democratic, laissez-faire, autocratic, transformational. Correct answer is autocratic leadership style. In emergencies, quick decision making is crucial, and an autocratic style allows leaders to make fast, directive decisions. Democratic leadership involves team input, which may delay action. So it will take time. In emergency situation, we cannot use democratic leadership. Laissez-faire is too passive, and transformational is better for longer term motivation, not in a crisis situation. Which principle of management emphasizes that employees should receive orders from only one supervisor? Unity of command, span of control, scalar chain, division of work. Correct answer, unity of command. We will see each option. Unity of commands prevents confusion by ensuring employees report to a single supervisor. Span of control means it refers to the number of subordinates a manager can effectively supervise. Scalar chain refers to the formal line of authority. The last one, division of work, refers to task specialization. So these are the options explained here. And in a quantitative research study, which of the following best describes a null hypothesis? A statement predicting a positive relationship between variables. A statement assuming no significant difference or effect. A hypothesis based on qualitative data. A hypothesis that is proven true at the end of the study. So null hypothesis means a statement assuming no significant difference or effect. So usually at the starting of a research study, the researcher will keep a null hypothesis. That means there is no significant difference or effect. If we find any differences, then null hypothesis is rejected. That is called alternative hypothesis. So I will explain here. A null hypothesis, it is represented by H0, states that there is no statistical significance between variables. So researcher assumes that there is no significant differences between variables. Usually, the researcher has to find out some relation between the variables. Then only he can move forward in that research study. Then alternative hypothesis means that predicts an effect. So here in null hypothesis, there is no effect is seen, but in the case of null hypothesis, there is a effect between variables. Qualitative data is not a part of quantitative null hypothesis. Hypotheses are never proven true, only supported or rejected. So null hypothesis is represented by H0. Alternative hypothesis is represented by HA or H1. Null hypothesis in a quantitative research study is a statement that says there is no relationship, no effect, or no difference between the variables being studied. In simple words, the null hypothesis is rejected. It suggests that a real relationship or effects exists. So that is called alternative hypothesis. If there is a relationship between variables, then it is called alternative hypothesis. 13th question. Which feature in Microsoft Word allows you to see all changes made by reviewers in a document? Track changes, compare, mail merge, format painter. The correct answer is track changes. Track changes option we can use. Track changes records, edits, deletions, and comments. So the reviewers can make edits, deletions, and comments. So the owner can see in the option of track changes. Compare, that is another option that shows difference between two documents. Mail merge is for mass emails and letters. Mail merge is used to make mass emails or letters. Format painter is used for copies formatting. Then 14th question. A patient with schizophrenia who believes the TV is sending them secret message is experiencing hallucination, delusion of references, echolalia, tangentiality. Correct answer is delusion of references. So, delusion of reference involves believing neutral events have personal meaning. So, the patient may give the neutral events to a personal meaning. Hallucination is a sensory perception without a stimulus. If there is a stimulus means it is called illusion. In hallucination, there will not be a stimulus. Echolalia means repeating others' words. Tangentiality is a off-topic speech. In that cases, the person started answering a question, but he will not reach the correct answer. But the just opposite, that is called uh, circumstantiality. In that, the person will touch different topics and finally reaches to answer. That is called circumstantiality. In tangentiality, the person will change the topic and he will tell different topic and will not reach the actual answer. Which of the following is a key component of effective nurse scheduling? Assigning all shifts to senior nurses, ensuring adequate nurse-patient ratios, allowing unlimited shift swapping, ignoring staff preferences. Correct answer is ensuring adequate nurse-patient ratios. Safe staffing, safe staffing ratios improve patient care and nurse satisfaction. Senior only assignments are impractical. There will be seniors, there will be juniors. So both has to be work as a team. Unlimited swapping, that means changing the staff from one ward to another ward. That causes instability. Ignoring preferences of nurses, that also lowers the morale of staff nurses. Which financial budgeting method allocates funds based on a justification for each expenses? Incremental budgeting, zero-based budgeting, fixed budgeting, flexible budgeting. Correct answer is zero-based budgeting. In that cases, for every expenses, that person has to justify. So I will explain each budgeting method given in option. Zero-based budgeting requires justify all expenses anew each cycle. Incremental budgeting, that adjusts past budgets. Fixed budgeting and flexible budgets adjust for volume, not justifying. So these are the different budgeting methods. So you can refer it for more details. 17th question. Which sampling method ensures every member of a population has an equal chance of being selected? Convenience sampling, purposive sampling, simple random sampling, snowball sampling. Correct answer is simple random sampling. In that cases, each sample has equal chance. Simple random sampling is unbiased with equal selection probability. Convenient sampling, that uses readily available subjects. So in that cases, the researcher will select the convenient sample, so which is easier to reach or easiest to access. In purposive sampling, it based on criteria. The researcher selects samples based on certain criteria. Snowball sampling means first researcher will select one sample and then that sample refers to that sample person will inform another person and recruits in that particular research. So by referring one by one, the sample will be large size. 18th question. Which of the following is an indication for a permanent colostomy? Rectal cancer, intestinal obstruction due to adhesions, traumatic bowel injury, diverticulitis with perforation. Correct answer here, rectal cancer is an indication for permanent colostomy. Permanent colostomy is often required when the distal bowel, like rectal cancer, is removed or permanently non-functional. Temporary colostomies are used in conditions like obstruction, trauma, or diverticulitis to allow healing. So, in order to prevent the stool matters to going that injured site, so there will be a temporary colostomies. It may fasten the healing process. Which of the following best describes a temporary colostomy? It is intended to divert fecal flow permanently. It is placed to rest the bowel and later reversed. It requires complete removal of the rectum. It is always placed in the sigmoid colon. So correct answer here. It is placed to rest the bowel and later reversed. So after the healing of the distal bowel, it may joins together. So that is called reversal. Temporary colostomy are created to protect distal anastomosis or allow healing of inflamed or injured bowel. Once healing is completed, the colostomy can be closed and bowel continuity restored. 20th question. In which type of colostomy does the patient usually have semi-formed to formed stools? Ascending colostomy, transverse colostomy, descending or sigmoid colostomy, cecostomy. So correct answer here, descending or sigmoid colostomy. So descending and or sigmoid colon, that is a end part of the large intestine. So by reaching there, the stool mostly formed or semi-formed or completely formed. In descending or sigmoid colostomies, the stool consistency is more formed because the colon has absorbed more water. Ascending and transverse colostomies produce more liquid or semi-liquid stools. Which of the following is a common reason for creating a loop colostomy as a temporary measure? Protecting a distal surgical anastomosis, providing a permanent fecal diversion, managing chronic ulcerative colitis, addressing an inoperable rectal tumor. So correct answer, loop colostomy usually used in temporary reasons. So in that you need to find out which is temporary, protecting a distal surgical anastomosis, managing chronic ulcerative colitis, addressing inoperable rectal tumor. So here loop colostomy is doing uh, for the management of protecting a distal surgical anastomosis. So later the colostomy will be reversed. It's an example of temporary colostomy. A loop colostomy is often used temporarily to divert fecal flow and protect a healing surgical site in the distal bowel. It is usually reversible once healing is adequate. So it is an example of temporary colostomy. So after that, reversible is possible. So that is about today's video. Thank you for watching this video. Please like and share with your friends, and don't forget to subscribe our channel, The Nurse. So thank you and best wishes for your upcoming railway exams.